So my name is Tuana Salies and I'm a dietitian and the professional lead for ABL Health, leading on obesity. So I've been asked in to kind of just talk to you guys about menopause, which is, I'm sure you know, quite a big topic going around. These days, you know, it's not such a taboo thing to talk about. So I just wondered, what does the menopause mean to you? If someone would shout out and just kind of tell me, you know, what's your experience? What, if you think about menopause, what does that mean to you?
And wellness.
Yeah, not feeling too great. Yep. Anyone else?
I guess there's a variety of symptoms, isn't there, that women experience, and it's from a team perspective, we know that a lot of our clients will fall into that category, but not necessarily know what to do about it. And so I think it's important that we know how to work with the clients going forward, really.
Yeah, and that's good, because sometimes what I'm hearing is kind of like helping women maybe to identify if some of the things that they're going through, maybe their weight increases or their body shape changes, or they're just feeling not great, could be a sign and symptom of the menopause. So maybe for you guys to know how to identify that and help the women, or signpost the women to the right support. Is there anything else, any kind of things that comes into your mind if you think around the menopause? Anyone else want to offer something?
There's a much greater awareness now. Because I'm the oldest of the team. So going back quite a few years, and all I've ever suffered were the hot sweats and just generally feeling a bit yuck. But now I hear all sorts of things that I never heard before, when me and my friends were obviously of that age. So it's really interesting to know what's going on.
Yeah, so Susan, if you reflect back, or you think back what you know now about the menopause, do you think that perhaps there was other symptoms that you've had that perhaps you didn't link into being menopausal?
No, I don't think so. I just would like to say that I'm still having those same hot sweats 20 years later.
All right. Yeah, that's a good point. All right. So it's really important to understand that menopause is not an illness or a medical condition. Okay. It's completely normal for any woman to experience menopause in their life. So it's a very normal thing, and all of us will go through it. You know, it's like taxes and death. You know, you can't avoid it. However, this means that it doesn't mean like we have to, pull up our socks and put on a brave face and just soldier on through it. Like my mom would say, no one ever talked to her about the menopause. It was just like, pull yourself together. What's your problem? If you have a hot flush, don't wear warm clothes. Go stand outside or drink some cold water. It's a kind of not being recognized, I think, in the past as something that can be treated quite effectively and well. So I'm really grateful and happy with like the celebrities like Davina McCall. I'm sure you've all seen some of her programs where they've really sort of highlighted menopause and took some of that myths away, so you have to just cope, or you're feeling guilty, or the feeling of just having to get on with life becomes quite a dreaded thing. So it took away that stigma about menopause perhaps not being real. And if our grandparents could cope with it, why can't we? And I think that just Davina McCall brought it to the table and said, well, actually, this is really real. It affects women in all sorts of ways. And it is something that should be highlighted and should be treated appropriately. I can tell you that I'm not shy to sound 46, and I started with early menopause when I was about 44. And honestly, I thought I'm going mad. I wanted to give up my job. I wanted to divorce my husband. I wanted to I couldn't focus, couldn't do anything. And the moment it was treated, I just turned back into my old self. And I think if someone didn't highlighted that to me and say that, go and see your GP, I think you're menopausal, I would have probably easily, stopped working and became a recluse. And, it was just a horrible situation. So people go through the menopause in different ways. Some people, like Susan said, it's maybe just the hot flushes, which is quite uncomfortable. But some people get quite a lot of different symptoms, which does make you feel like you're going a bit losing the plot in life. So I hope after this session you kind of got a very good understanding of menopause, looking out for the symptoms, and knowing what you do. So I've got a little bit of aims here for you. So we'll look at the different stages of menopause, the role of the different hormones that we talk about, causes, potential causes. I did say already that it's kind of normal life for women, but we'll look at perhaps other things that can cause it, diagnosis and the symptoms of menopause, the role of HRT, and then, of course, the kind of bits, the practical bits for you guys. I think after HRT, we'll have a little bit of a break, and then we'll look at diet, activity, mental health, and things like sleep. And then I've got some resources for you as well, that you can sort of share with your clients, or kind of go and look at yourself to update your own knowledge on the menopause after the session. Does that sound all right? Sort of aim-wise?
Yeah, sounds good.
Okay. So kind of what do you know about the different stages of menopause? What have you heard? What kind of different stages is there?
I guess it's perimenopause is the actual time, isn't it, where we suffer all the symptoms, and menopause is just one day, but we tend to sort of put everything into menopause, when actually it's perimenopause that all the horrendous symptoms come in.
Yeah, that's right. So yeah, there is different stages. So I'll go through them. So we get this early menopause. That's when menopause occurs before the age of 40. And this is classed as premature ovarian insufficiency, so PIO. This can sometimes run in the family. So if your mom started with early menopause, you're more likely to start with early menopause as well. It's a bit of a myth to say if you started your periods earlier in life, that you will start menopause earlier as well. There is a little bit of a myth around that. So this is just kind of a different reason why people start with menopause quite early. Then we also get premenopause. So that's the stage in your life where everything is going well, your hormone levels are at a normal level. So this is people from the ages of 18 to sort of 40, 45 years old. So no symptoms, completely just kind of carrying on with life. Then we get the perimenopausal stage. So this is when you experience the symptoms rightly that Kirsty have said. So this is when most of the hormone changes happens, but you still have your period. So perimenopause can affect people from the age of anything from 40 upwards. And it can have a huge effect on people. Like I said before, so there's evidence to say that it can affect women in their work. There's about 14 million workdays lost in the UK because of perimenopausal symptoms. That's a lot. And many individuals don't even realize that they have perimenopause, or even menopause for that sake, and put the symptoms down to things like life events like stress and being tired and the pressures of life, rather than thinking, okay, there's something wrong with me. And I can definitely say that's where I was. Perimenopausal perimenopause can last for years, and it most commonly affects people during their 40s. It's often described as the time before the menopause actually starts. And I'll give you the definition of when menopause is reached. Your periods might typically change. So you might have periods close together, or very heavy bleeding, or very light flow, and then irregular periods. So maybe skipping a month to 3 months. The hormones estrogen and progesterone work together to regulate your menstrual cycle and also the production of eggs. So this is where the changes start happening. So during the perimenopause, the level of these hormones fluctuate quite greatly, and it's often the imbalance of these hormones which leads to the symptoms of menopause. For some people, symptoms only occurs for a few months, and then the periods stop completely, and that's when they reach menopause. However, others experience symptoms for several months or even years before the periods actually stop and they're in menopause. So the next stage really is that menopause. So menopause is really defined as when the ovaries have stopped producing eggs, and the production of the hormones of estrogen and progesterone and testosterone fluctuates and then falls. This usually happens as it's, like I said, it's a natural process. And it's normally sort of, you reach menopause when you've not had a period for 12 consecutive months. And the average age in the UK is around at the age of 51 when that happens. And then we've got post-menopause. So this is in the life after the menopause. So we want to stress that these hormone levels isn't something that's just going to miraculously start to pick up post-menopausal. So if you have low estrogen levels, they keep on being low for the rest of your life. And that's why treatment is so important for women. So I've also got this nice picture that I found on Mr. Google, and just kind of showing the timelines of menopause, which is quite, I think, a nice summary of what's happening there. So I'll move on to the role of estrogen. So why is estrogen so important? So estrogen is responsible for the growth and the continued development of your reproductive anatomy while you are growing up, including things like your vagina and uterus. It's also responsible for the development of your breast and the growth of your pubic hair and armpit hair during your puberty. So it's a really important hormone as we develop as from girls into women. Together, these changes signal the upcoming arrival of your first menstrual period, which marks the beginning of your childbearing age. So estrogen is responsible for that. So estrogen is really the hormone that's responsible for building up the lining of your uterus every month in preparation for pregnancy or having a baby. So it is really important. And this is the hormone that really falls during the perimenopause stage. So if we look at what is the role of estrogen, so it's really important for the development of our bones. It regulates the bone turnover in the adult bones and protects against bone loss. So in menopause, when estrogen levels starts to fall, women can experience a significant increase in bone loss because of this protective effect of estrogen not being there anymore. This dramatically can increase bone loss for women and lead to things like osteoporosis, which puts women at a much greater risk of having things like a hip fracture, which I'm sure you will know that can be quite detrimental as you get older. Estrogen also protects against heart health. It keeps your blood vessels healthy, including decreasing inflammation and controlling things like cholesterol levels. The positive effect of estrogen on the prevention of heart disease is quite significant in premenopausal women. So when before the menopause starts, your estrogen actually protects you and in quite a good place. But it's after menopause, when that estrogen is gone, that the rate of heart disease in women increases quite rapidly. So again, stresses that importance of, if you have the estrogen deficiency, that it needs to be topped up as we get older. Estrogen is also important in your brain health. It is thought that estrogen affects how your brain structures are connected. So it's actually got a physical importance there, physical role it plays. And it affects how your brain communicates to your cells and even can change the shape of your brain. So I'm sure, I don't know if you watched the recent Davina McCall program. If you haven't got, they've talked to brain experts and shows you how low estrogen can affect your brain physically. And that's why people can get so forgetful and this what they call like a fuzzy head, struggle to focus, struggle to remember stuff. I remember coming to my laptop in the morning and switching it on and not being able to remember my password, which I put in like a million times a day, because every time you leave your laptop, it closes off. And I just couldn't remember my password. So really silly things, can't remember names of your friends or your co-workers, and you just feel like a plonker. So it's really got to do with that lower estrogen levels that you have. Estrogen also plays a role in the production of serotonin. So serotonin is our feel-good hormone, and serotonin is released, for instance, if we do lots of activity or we have a really good laugh at a funny movie. You feel good after that. But if you have got low serotonin levels, low estrogen levels, you are not able to make serotonin. So that leads to things like depression or anxiety, or just a feeling of general low mood most of the time. So, even the sort of the symptoms that I think we sometimes just feel like, oh, I'm just having a bad day at work, could be caused by low estrogen levels. Estrogen also stimulates collagen production and blood flow. So collagen is responsible for a smooth skin and a firm skin. So as estrogen levels drop, so does our collagen production, and that's when you start getting wrinkles. So you lose the elasticity out of your skin, and that can have a huge impact on how you feel about yourself and how you look in the mirror. So again, it's something to do with estrogen, which we so easily can overlook and think this is just a normal part of aging. So any comments so far, any shocks or no? So causes of the menopause, I've already said it's very normal. The average age of menopause in the UK is about 51 years old, and perimenopause normally starts around the age of 45. So the menopause is not a condition that just affects older women, though. It can affect people in their 20s, 30s and 40s as well, as trans men or some non-binary people as well. The menopause affects everyone indirectly, as you will most likely live with and love and work with people going through the process of menopause. So, my partner would say that was when I was going through the menopause, that was quite hard on him, and bless him, I do feel a little bit sorry for him, but I feel more sorry for myself at that stage in any case. So, even if you're not affected by the menopause, you'll know people that gets affected by it. So let's look at other reasons why people can have symptoms of menopause. So surgery can cause a medical menopause. So having a hysterectomy, even if they left your ovaries, so they didn't have to take your ovaries, that can eventually lead to quite an early menopause. If you had your ovaries removed for whatever reasons, cancer or things like endometriosis could be a reason. If you had radiotherapy to your pelvic area as a treatment for cancer, or if you had certain types of chemotherapy drugs to treat cancer, that can also cause an early menopause, especially for things like breast cancer. If you had a medical or surgical treatment for endometriosis or premenstrual syndrome, that can cause early menopause as well. Some genetic and autoimmune factors can contribute to early menopause, and I think that's kind of where, if you have early menopause in your family genes, you probably get it as well, and your kids will get it too. And I've said about hysterectomy already. So that's just kind of considering that, yeah, menopause is a very natural thing, but there could be other factors coming to play that can cause early menopause. And I would hope people that's been through things like surgery or cancer treatments, that would have been highlighted to them. But I know of a few patients and people I know that it's not been highlighted. So it's just another thing to kind of keep on your radar when you're working with women. So what's the symptoms? What kind of symptoms are you aware of before I go to all that symptoms? Or what does people come to you that makes you think, oh, they might be in the menopause?
Some of my clients have said about mind fog.
Yeah, Sam, does that make sense if I explained about that, how estrogen plays that role in your brain health?
Yeah.
And it's a real true thing, it's not just kind of having a bad day. It's really true, and it's the real lack of concentration and lack of ability kind of just to remember stuff and think clearly is gone. So mind fog is a big one, and I think that really can affect your work. Anything else that people has come to you?
The hot flushes and the night sweats.
Hot flushes and night sweats, yeah, again, very uncomfortable, isn't it? You could sit in a meeting or be working with someone, and it just overwhelms you, this hot flush, isn't it? And the night sweats, it has a big impact on your sleeping pattern and how much you are able to sleep, isn't it? So a real impact on your day-to-day life if you struggle with these things. Anything else?
Joint pain seems to be quite a common one as well.
Yeah, it can bring on some joint pains. You're right. So we've got that pains and mood changes on that first slide. Anything else that you think, if you're talking to a woman, that you might think, oh, I wonder if this is the menopause starting for them?
Excessive bleeding.
Yeah, it could have quite playing havoc with your period. So I think, don't be shy to ask about periods if people, I know they come to you with their weight and seeing how you can support them to achieve a healthier weight. But asking these questions from the age of 40 would be quite interesting to see, to maybe assess if it could be the start of the menopause for that woman. Okay, so during perimenopause and menopause, we've already said hormone levels really fluctuate quite greatly, and this imbalance results in a lot of symptoms, and I'll go through a wealth of symptoms with you after this slide. So 3 out of 4 women experience symptoms, so quite a lot of us, and you're quite lucky if you just have like hot sweats or night sweats and hot flushes. There's a wealth of symptoms, and a lot of women experience a variety of different kind of symptoms, which can, we said, really affect your own life, your home life and your work life. The severity of symptoms can vary tremendously as well. So some people just have a hot flush every now and again, and they cope with it quite happily, and they don't feel like they need the need for treatment, while others experience it quite severely, and it might go on for years and years as well. Symptoms may overlap things like depression, sleep issues, sexual problems, appetite changes, low energy and poor concentration. So you feel like that's the problem, where it can actually be the low estrogen levels. So it's worthwhile noting those and seeking support from your GP if that occurs, not just thinking it's just you and life. Medication side effects can mask menopause. So if people are on SSRI medications like citalopram, sertraline, fluoxetine, they can cause things like insomnia or difficulty sleeping, tiredness and sexual dysfunction as well. So if you're on those tablets and you experience those symptoms and then start in the menopause as well, you might just blame the tablets rather than thinking there's something else going on for you as well. So it's very important to kind of just keep talking, I think, and not just sort of saying it's a tablet that I'm taking that's causing these problems. So it's quite common actually for menopause to be misidentified and mistreated as part of mental health illnesses, because mental health illnesses and medication you take can have other symptoms of people which looks very similar to the symptoms that people might have being perimenopausal or in the menopause. So what are the symptoms? So very common symptoms, possibly starting with period changes. That's normally the first sign. So the flow changes, becomes less frequent before it completely stops as you go into the full menopause. Hot flushes is also very common symptoms and affecting 3 out of 4 women. So hot flushes can come on suddenly at any time of the day, spreading through your face, chest and body, making you feel quite warm and changing your skin color to a really red color or blotchy appearance. So, you know, if you're sitting in the middle of a meeting and that happens with you, or you're working with a client and it happens, it could be quite distressing for you, because it could be quite embarrassing or, you know, making you feel quite self-conscious. For some women, it may last just a few moments and then it's gone. For other, quite a few minutes. And hot flushes can also be associated with things like being very sweaty then, dizziness, and even some heart palpitations. We sort of feel your heart in your chest, beating in your chest. That can be quite uncomfortable and a bit frightening, really, if you feel that. So night sweats, again, quite common. Many women find that they wake up during the night feeling completely drenched in sweat, and they might have to change their pajamas, and they might even have to change their bedding if it's so bad. So it can be quite disruptive. It disrupts the sleep, and we all know how important sleep is. So we'll talk about sleep a little bit later. So it can be disruptive for yourself and your own sleeping pattern, but also perhaps for your partner too. So, and you know, 2 people not sleeping well and communicating the next day could be quite challenging, isn't it? And mood changes. Some women suffer from mood changes, almost like PMS-like symptoms. So either feeling very tearful or just feeling a bit angry or just feeling quite low and a bit short-tempered. As well, can find something that's really quite common here is anxieties. If you've never suffered with anxieties, kind of feeling anxious all the time, and it could be over nothing, you know, things might be going quite well in your life, but just feeling this feeling of anxiety, like someone sitting on your chest, and you're just struggling to cope, and you're just struggling to see the positive things in life. And that's got to do with that low estrogen levels and the production of serotonin in your brain. Fatigue and poor sleep. So the night sweats and anxiety and hot flushes can affect your sleep, like we said. However, people can feel quite tired during the day, regardless of having a good night's sleep or not. So just general feeling of tiredness is quite common as a symptom for perimenopause as well. Brain fog. Yeah, I can really resonate with this. So this is a collective term for things like having memory slips, very poor concentration, difficulty absorbing information, and feeling your brain is a bit like cotton wool. Brain fog can not only present a challenge at work, but it also affects the simplest tasks like reading a book or focusing on listening to a radio program or following a story on the TV. Even following a recipe, you know, finding it really hard to follow a recipe to make something, you know, so it can be as simple as that. So if you've got a job that's quite important and you have to concentrate really well while you're working, you can imagine how brain fog can really be a challenge for people. Loss of sexual desire, so feelings of tiredness and low mood and experiencing night sweats can all contribute to this. There's also hormone reasons why your libido might feel rock bottom. So women have testosterone as well as men, and this hormone can fluctuate, and that really kind of influences your sex drive. So normally it's either sort of goes up and down through the perimenopausal phase. So if it's low, you just don't feel like having sex. And testosterone levels tend to decline in women during menopause, and that could also drive that loss of interest there. And that can have a massive impact on your relationship with your partner, isn't it? So, you know, and can be the causes of things like divorces or breakdowns in relationship, especially if it's not being identified as being premenopausal or menopause, you know. Joint aches and pains, someone mentioned that as well. So estrogen is very important to provide lubrication between the joints. So it also prevents things like inflammation in the joints. So low levels can leave you feeling quite achy and having sore like joints. And again, that could be put down to age and wear and tear, but it could, you know, very well is linked to the menopause as well. Hair and skin changes. So we talked about estrogen building up your collagen levels, and this collagen protects the structures of your skin. So lower levels of estrogen can lead to a reduced elasticity, fine lines, very dryness of skin. You know, I remember slapping on E45 like you'll never believe, and just being left with an itchy, dry skin all the time. So women can also start to develop acne, like older adult sort of poor skin, and that can be also, you know, quite detrimental in the way that you feel about yourself, and it can affect your mood and your appearance as well. Changing hormones can also make your hair thinner and less glossy, and you might even note an increase in facial hair growth. So that's when you typically will grow a little bit of a mustache or longer hair on your chin, which again also really can affect the way you feel about yourself. Other common symptoms is worsening of migraines. So those people who do suffer from migraines and might be on a treatment for migraines might find that they get migraines much more often and perhaps much more severe. And again, that can have a huge impact on your life, because people who suffer from migraines might have to find that they have to lock themselves away in a dark room for half a day or a day, and that's all time lost with your family, time lost with doing the things that you need to do, and time lost perhaps at work. So it's a common symptoms, but one that can actually affect your life quite in a quite a bad way. And vaginal and urinary symptoms as well. So low estrogen can cause the tissues around the vagina to become very thin and dry and itchy and inflamed. So you can imagine having sex then, which will be very, very uncomfortable and even painful. So you would avoid it like the plague, and I won't blame you. So estrogen also plays a role in the lining of your bladder. So people might find that they have to urinate more frequently, so have to go for a wee often. They might actually have to get up at night to go for a wee. I've heard about people sort of starting to bedwet because they don't actually, you know, they can't control their bladder as well as they used to. So I mean, just imagine how that might feel if you sort of a 45-year-old woman starting to wet the bed at night. Things like if you're active and you're playing sports, or you're walking around quite a lot, or if you laugh or sneeze and you leak urine, so that can be quite uncomfortable and embarrassing as well. Urinary tract infections is also more common during these phases. So is there anything from these common symptoms of menopause that you guys want to comment on? Is there any surprises or anything you didn't know that is linked to low estrogen levels.
There's just a lot more than I realised or knew about.
Mm-hmm. Something that it's also that I do want to mention is, especially with hair and skin changes, and that estrogen it can actually affect your eye health. So people might find that they're struggling with very dry eyes. That could be a clue, but also then they're having to change the prescription for their eyes if they're wearing glasses. So that's another thing that can be affected. With low levels of estrogen. So yeah, so I'm hoping this, these things should be stuck in your brain, and when you work with people and symptoms comes up, and you kind of ask around it more with open questions and kind of gaining more information, that this will maybe help you to decide if you can say to a woman, go and speak to your GP about these symptoms. Also, just wanted to kind of just emphasize the long-term health conditions that can arise from menopause. So especially if it's not treated. So left untreated, and for those people who think they should just soldier on. So we're looking at our bone health. It is extremely important, bone health. As we get older, and if our bones get weaker, and we end up with osteoporosis and things, it really affects you in older age. It can sort of stop you being independent as you get older, which is as you retire, that's the time of your life when you're supposed to be doing all the things that you wanted to do in your life. And, developing things like severe osteoporosis can stop that from happening. So estrogen helps keep our bones strong and healthy. But as we get older, this decreases, and we can develop a real big risk of osteoporosis, much greater than men. Women can lose up to 10% of their bone density in the first 5 years after the menopause. So after your periods have stopped and you are very low in estrogen, you can lose 10% of your bone density. Is a lot. So other factors that increase the risk of bone weakening are family history. So if you've got family history of osteoporosis, or you've got lifestyle behaviors that you like, smoking and drinking heavily, or not in generally having a good diet, or not taking part in any movement, that can also increase your risk of osteoporosis even further. Cardiovascular disease. So this is conditions affecting your heart and blood vessels, such as coronary heart disease or congenital heart disease, things like strokes or vascular dementia. So estrogen helps keep our blood vessels healthy, as I said before, and helps control things like our cholesterol levels. So fluctuating estrogen levels can increase the chances of getting cardiovascular disease. Other factors that increase your risk of getting cardiovascular disease again includes things like lifestyle changes, but also high blood pressure. So if you're smoking or overweight or have a family of cardiovascular disease, that increases your chances as well. So if you've got poor lifestyle choices, but also low estrogen levels, it really increases your risk of having things like a heart attack or stroke, or getting vascular dementia at an early age. Vaginal dryness and urinary symptoms. I've already talked about this, but it is a long-term condition as well, and it can really affect people in the day-to-day life, with things like bladder control, UTIs, and even thrush. So thrush is quite common. If you get recurrent thrush, you do need to kind of rule out, because things like type 2 diabetes, undiagnosed or not very well treated or managed type 2 diabetes, can also cause things like thrush. But these symptoms can get much more noticeable during the menopause, and it can be quite troublesome for people as they get older. So just a little bit on HRT. So HRT is basically the most effective way to treat symptoms in the perimenopause and menopause. So it replaces that hormones that you are not producing as you're going through the menopause, and I'll go through that hormones in a minute. So it's also really important to go on estrogen sooner rather than later. Okay, so it's again that predictive thing. So if the menopause, if the estrogen is low and you're experiencing symptoms, and you might experiencing that for years and you just crack on with life, it might not be as effective as it would have been if you picked up on it much earlier. So it is a preventive thing, and really preventing things like heart disease, osteoporosis, diabetes, depression, and dementia in the future. So let's look at the different types of estrogen or HRT. So you get a estrogen where it's just replacing the estrogen that your body is losing, and that can be done in a patch. It's a bit like a plaster that you put on your skin. You normally put 2 patches on in a week, and it's just a slow release of estrogen through 2 or 3 days. It can also be done in a gel form or a spray, or there is a tablet that you can take to replace estrogen. Progesterone is another hormone that needs replacing. So if you still have a uterus, you might need to replace progesterone alongside the estrogen. And this is known as a combined HRT. If you have things like a coil fitted, you might not need that. You might just need estrogen patches. So the GP will decide on what's the best for you. Testosterone, so some people have got quite a variation in testosterone, and that can lead to symptoms like fatigue, feeling really tired. You know, if you are someone who does regular exercise, you might just feel like I can't do this anymore, you know. So even, you know, if you had a good healthy lifestyle, you might think, no, I can't, you know, and then fall back into not being active or not doing the things that you would normally do. It also contributes to the brain fog and the loss of libido or the sex drive. So testosterone can be beneficial in addition to estrogen to bring in further improved symptoms. So the estrogen will improve it from the start with you replacing some of that estrogen. And we just talked about the different ways that estrogen works in your body. But if you're still feeling things like the fatigue, brain fog, loss of sex drive, it might be an addition to that, so testosterone. So it's available in gels, creams, or an implant, and it is licensed to be used in the UK. But I think sometimes, you know, if you find that you're on estrogen and you're still feeling some symptoms, it's worth going to speak to your doctor to see, do you need some testosterone as well? And to sometimes it's trying it and seeing if it works or not, rather than not trying it and just carrying on. So what's the benefits of HRT? Your symptoms will improve, which is a great benefit. People normally return back to the old self, as you would say, in sort of 3 to 6 months of starting HRT. So it works quite quickly, really, especially if you've been struggling with these symptoms for a while. It's just amazing how you know, it's like someone switching on a switch in your body, and you just start to feel back to your own self. Your risk of developing sort of the long-term conditions like osteoporosis will be less. Your risk of developing cardiovascular disease will be less, so you'll be less likely to develop things like heart problems, stroke, or vascular dementia, which is fantastic. Your risk of diseases will reduce, so things like a future risk of getting type 2 diabetes or osteoarthritis, bowel cancer, and depression are also decreased. And this has probably got to do with the replacing that estrogen, feeling better, not having that weight gain that comes along with being perimenopausal and menopausal, especially the weight gain around your tummy area. It can also help sleep and improve your energy levels. So with that, you're probably more likely to have a healthier behavior. So being active, eating healthier, sleeping well, and that further reduces your risks of things like type 2 diabetes, etc. So the benefits of HRT really outweighs the risks, and this is where a lot of myths was about HRT increasing the risk of having, for instance, breast cancer. Where now we know it's such a small risk. Actually, the risk of being overweight and having unhealthier behaviors because of what estrogen, lower estrogen levels, how it makes you feel, that risks are actually much higher to causing things like breast cancer or cancer than the HRT in itself. So it's really important to kind of stress that. If you have a history of liver disease or blood clots or things like migraine, there might be a small risk of that being higher. So, but taking things like a patch or a gel or a spray is much safer than at that stage and taking a tablet. So it's not to say you can't have it, it's just how you take the HRT becomes important then. Sorry, I've just got some bits here. Yeah, so basically what I do want to stress is that outweighing the risks, just because you'll be able to have a much healthier lifestyle if your estrogen levels are at the right level, and also kind of decreasing all that long-term risk factors associated with low estrogen levels is important. So it does outweigh the risks there. Just briefly kind of thinking around menopause and weight gain. So many people feel that the weight gets much harder to manage as we get older. In any case, we often approach menopause already struggling with our weight, and getting menopause, going through the menopausal or perimenopausal years, it makes it even harder. So again, the reason for that weight gain is fluctuating estrogen levels during the menopause can lead to weight gain, because it affects the way that we store fat. So this is because your fat cells produces estrogen, which offers the body a safety net if it's running low on estrogen. So to explain that, so your fat cells produces estrogen. So if your estrogen level starts to fall, your body is going to go into a fat storing phase. So it wants to store fat inside your body because it knows that the fat produces estrogen. So if your estrogen is low, it's going to lead to fat storage. Does that make sense? And that fat storage is normally around your waist. So people sort of start to change body shape. And they get a bigger waist circumference as well, which doesn't do our girls any favors in how we feel about ourselves. The other reason is low progesterone levels are also linked to things like water retention. So water retention in itself isn't weight gain because it's not a gain in how much fat we've got in our body, but it does make you feel quite uncomfortable in your clothes. You know, you get swelling, you can't put on your rings, you can't wear your favorite shoes, you know, your buttons on your trousers won't get together and you can't button up your trousers. So that's it normally fluctuates. So one day you might find that you're fine, and the next day you're so swollen up that the jeans you wore yesterday just don't even fit you today, which is not great. Testosterone might also be higher at the start of the menopause, which also stimulates fat accumulation around your waist rather than around your hips. And that just goes onto that kind of middle-age spread that we sometimes call it, where that fat just sort of gets stored around your waist. Another factor is an increase in insulin resilience, which makes our body store energy rather than burn it for calories. It also affects the way that we store fat. So again, it's the low estrogen levels, the higher testosterone levels in the beginning, and some insulin resistance, which makes this sort of increase in your waist circumference more likely to happen during the menopause. It's also your body burns calories much slower when you're going into the menopause. For instance, if you eat 1,000 calories, your body would normally burn 700 of that and store 300. But after the menopause, it's kind of the other way around. So even if you just have a few extra calories in your diet that you shouldn't be having, the weight increase could be quite a lot bigger, because your body just don't burn calories in the same way. Psychological impact of the menopause can lead to weight gain as well. You know, you all know if you're feeling low, or you're very anxious, or you have a lack of energy, so you don't plan your meals, you might just go for a takeout rather than cook, because you just don't have the energy. You don't have the energy to move your body and go for a walk, or clean your house, or do some gardening, or do your exercises that you normally would have done. So really the psychological impact and the feeling of tiredness a lot of the times can cause weight gain in itself, and really makes weight loss, or the things that you need to do to address your weight, like planning your meals, getting organized, you know, being motivated, doing physical activity, having healthier food. It makes it all so much harder. I do want to stress that HRT in itself does not lead to weight gain. A lot of times people starting on HRT actually feel that they can manage their weight a lot easier than without HRT. But there is some misconception that sometimes HRT in itself leads to weight gain, and it's simply not true. There's no evidence about that. A number of people might find that when they start on HRT, they have a little bit more of fluid retention, but it's normally transient. So it starts and then it goes in a month or two. So it's just kind of getting women to continue with it, rather than just sort of giving up too quickly on HRT. I would definitely say if you start, you have to give it a good 3 months before you assess if you are feeling better, and if that was a low level of estrogen that caused the symptoms for you. And so just a little bit about diagnosis of menopause. It's you can be diagnosed with menopause according to what your age is, perhaps your periods and your symptoms. So because estrogen levels changes all through the day. So if you have a blood test and your estrogen levels is normal on that day, it won't bring out from the blood test alone that you are in menopause. So it is important to tell people that it's not just a test. You don't go to the doctor and they do a test and you get diagnosed with menopause. It's more around what is your signs and symptoms and what is your age. A lot of times GPs today will just talk to women around those topics, rather than actually even doing a blood test. And then it's to try people on HRT replacement and seeing if those symptoms improve. So I think I've been talking to you for more than 50 minutes now. So shall we have a break and a drink? And Stevie, if you don't mind pausing it. Yeah, and we'll come back. So let me just check the time. So it's 11. What about 11:15? Come back and we'll have the rest of this presentation then. Does that feel all right?
Yeah, that sounds good.
Okay, so thanks, Stevie. Let's look at sort of living well through the perimenopause and menopausal phases. So what can we do to support our clients that we work with? So sleeping well. We do have to talk about sleeping well. This is a really good place to start. It's one of the most important building blocks of having a healthy life, isn't it? It's getting a good night's sleep. Unfortunately, for many menopausal people, this is very elusive. It's a if only aspiration, like if only I can have a good night's sleep. So disruptive sleep is really predominant in perimenopause as well. Sleep is not like your bank account, so you can't accumulate a debt. So not sleep well for a few nights and then having a long sleep in on a weekend doesn't sort of cut it. You need constant good sleep to get the benefit from sleep. So why do people struggle? So there's many reasons: hot flushes, sweats, and the mental health changes, things like anxiety, depression, but that can lead to worrying. So if you wake up like 2 o'clock in the morning and things are going through your head and you're worrying, it can stop you from going back to sleep. The lack of sleep, for example, 4 to 5 hours a night instead of 7 to 8 hours a night, can have a really big negative effect on how your brain functions, and it makes the brain fog and memory issues even more difficult to cope with. It can lower your immunity, making you more susceptible to kind of all sort of illnesses, so like from the simple cold to maybe chest infections or skin infections. So it just kind of lowers your immunity and makes you much weaker to cope and fight off bugs. It increases your risk of developing heart disease and cancer as well, because you don't get that deep sleep where your body can just go back to neutral and just kind of completely recharge as well. So how can we improve our sleep? I'm sure you talk to your clients about sleep already. I love this Sleep Council website. It's got very good practical information, leaflets, and that you can print out or buy in for clients, but also just direct people to go and have a look at the Sleep Council website. NHS has also got a lot of really good tips and ideas around sleep hygiene, so kind of how to get people to have a better sleep pattern. So for us, it's kind of following a regular sleep schedule is quite important, sort of trying to go to bed at the same time at night and trying to get up in the same time in the morning as well. So kind of this going to bed regularly in the week, and then on a weekend, going to sleep at 1 o'clock and waking up and 1 the next day if you're lucky. It doesn't really help towards improving your sleeping pattern. So in the initial phases, you do want to sort of go to bed at a regular time, sort of, let's say, between 10 and 11 or 9 and 10, making sure you work out that will give you approximately 7 or 8 hours of sleep per night for when you need to wake up the next day. Of course, this becomes really difficult for people who are shift workers. So talking around how to make their bedroom comfortable, using blackout blinds or sleeping with a mask, noise reduction, so maybe sleeping with some soft music in the ears, or asking the rest of the family to keep it quiet when it is their sleeping time. But we have to acknowledge that in today's life, a lot of people do work shifts and shift patterns. And although we know as medical professionals that is really not good for our bodies, it sort of, you don't always have the choice, is it? You do what you have to do because you have to do it, and because that's your source of income. And if shifts is part of that, then you just have to make the best of that and look at how you can improve things like your sleep regardless of your working hours. We would avoid people taking a nap in the afternoon, and I know this could be quite hard if you didn't have a good night's sleep. You might not even plan a nap, it might just happen. And but actually napping can make your sleeping and falling asleep at night a lot harder. It may keep you awake much longer than intended to. So trying to go through that tiredness napping phase, maybe avoid sitting on the sofa or lying down on your bed and stuff, and maybe doing something more physical. Sometimes having a cold water, glass of water could help to wake you up, or just standing in the garden or going for a walk and standing in the sunshine can wake all that, release that melatonin that wakes us up. So if you're finding that to start having a regular sleeping pattern, you need to stop having napping, some of those advice could help you to not have that nap. Develop a really good bedtime routine. So some people like to go and have a warm bath or a nice warm shower, maybe having some lavender in your room, because that can be quite soothing and help people to go to sleep. Reading a book rather than watching TV or reading on your phone or having any of that lights on in the background. So going back to an old-fashioned book and a bedside lamp if you have one. Some people like to listen to some soothing music as they drift away, or maybe to things like an audio book that could just be that background noise that you might like. There's lots of apps that can help as well that you can download, sort of download to help you sleep. Sort of apps like soft like waves in the background, or cricket like noises, or rain noises, to just stop that sort of your brain from overthinking and not switching off. We kind of just listen to that music and keeping your brain focused on that, sort of a bit like meditation, then can be useful to get you in that good sleeping pattern. So the blue lights have already mentioned that. We all know how that really can affect it. Releases melatonin wakes you up, and therefore it's so much more difficult than to go to sleep, because you've just got this waking up hormone in your body, but yet you want to try and fall asleep. So it's a really good idea, about an hour up to when it's your actual sleeping time, to sort of switch off all devices. Keeping your bedroom at a really comfortable temperature, sort of cooler, would be better than too warm, especially if you struggle with night sweats. Having maybe a breeze go through the room, so if you can open a window and a door so there's a breeze going through, and being quiet, and again, that is something that's not always in your control. If you live on a busy road, or you live in a neighborhood where your next door neighbor is having a party until 3 o'clock, it's kind of finding out what you can do to best cope with that. So, and I do know a lot of people have found putting on background noise that they would focus on rather than the noise outside of their room could be useful. Exercise, I don't need to preach to you, but the importance of exercise, keeping it regular and not too close to bedtime. The exercise also releases that fight and flight hormone, so it can help you to not feel so anxious or low in mood. It increases your serotonin level, and it tires your body out, so you feel like your body needs to rest, and it's so easy for your body then to sleep. Avoid having really large meals close to bedtime, or caffeinated drinks, which can be found in coffee, tea, and things like chocolate. So try not to eat those too late in the day, because that can really affect your sleep as well. Probably swapping to a decaf drinks is a really good idea. It's a simple swap that people can make, and it doesn't take a lot of brain power or energy, really. Just as a word about alcohol will maybe set you to sleep, but it won't keep you asleep. And normally people who has alcohol would wake up in the wee hours of the morning and then struggle to fall asleep again, and that can have a detrimental effect as well. Things that you could consider: taking a magnesium supplement with vitamin B added to it. Magnesium is there's evidence that magnesium can really help improve your sleeping patterns at night as well. So it could be something if people are really struggling and they might have made some changes in their sleeping schedules and their bedroom and all that, might have done that and still struggling. So magnesium supplements might be something in addition that they can try. I'm not going to talk too much about this. I am very sure you are well aware of the Eat Well guide. Getting people to try and include the macronutrients in their diet is a really good starting point. Looking at what they would choose, trying to avoid too many kind of fatty foods and high carb foods and meals, and just kind of following the basics of the Eat Well guide. I'm not sure if do you guys use the easy plate method, especially around weight loss? Have you seen that before?
I haven't seen it, Twane, but I don't know about the rest of the team.
Yeah, it's something that we use now within the new Silo program that we deliver So we use a
Okay.
combination of the Eat Well guide and then the Easy Plate to help kind of with portioning and things like that as well.
Okay, so I don't need to preach about that, but it is a really good way to help people to control their portions much easier. We would normally recommend you put in your vegetables first, take up that space in your plate, and then the rest is for protein foods and fiber-rich whole grain foods or carbs for the other quarter of the plate. So it's just really easy not to overfill your plate. So a lot of people might have half of their plate full of carbs and the rest, the smaller bit, from the vegetables or salady stuff. So yeah, it's just a really kind of easy and visual way to help people to control their portions. So I'm glad you're using it. That's good. So eating well, just kind of thinking of other things that we could perhaps advise our clients on. The Mediterranean diet principles works really well here. Is there something that you would talk to your clients about as an option? Has anyone heard of the Mediterranean diet before and what that means?
I have.
Okay, yeah.
Elliot,
So-
Hannah, is it something that's included again in the Xyla program? I'm looking to you now.
It's not really included in the Xyla program. We sometimes touch on it in terms of like healthy fats and things like that, but it's not actually specifically kind of outlined as the Mediterranean diet. So it's not something that we specifically kind of look at.
No problem.
I know personally, I use it quite a lot as well, especially in the summer. To be fair, call it the Costa del Sol scunthorpe diet.
The sunshine diet. Yeah.
Pretty much, yeah, for summer use.
Yeah, and I think it's probably easier to follow this in the summer, you know, because in Mediterranean they don't have a lot of winter days, so it is probably easier for our clients to follow this in the summer. But it's exactly what you said. So the principles of that is really, sorry, I'm misclicking on the button. Having a low intake of processed food, meat and dairy products. So really be mindful of limiting processed food. So by that we mean the kind of the bacon and the sausages and the salami, pepperoni, maybe ready meals that's highly processed, or take out things like McDonald's with really processed products in there as well, highly processed foods, which we know doesn't fill us up much, leave us feeling hungry quite quickly afterwards. It's so tasty and easy to eat that people would overeat on that as well. So kind of this highly processed food that sort of includes things like sweets, treats, crisps, biscuits, cakes, things like that. So it's kind of just being mindful of how much of that people eat. Having a diet low in salt and sugar is also part of the Mediterranean principles. So what we want to focus on is a high amount of vegetables, things like healthy fats like nuts, unsaturated fats like olive oils, and high intake of beans, legumes, chickpeas, lentils, all those really, really cheap products. So if we're thinking in today's life with everything just getting more expensive, we know that lower socioeconomic incomes, people normally struggle with weight more, and these foods are generally a lot cheaper than meat or even fish. So it is a really good idea to try and increase that and in the diet without really breaking the bank, but giving really good nutrients to people. Sort of cereal, sort of whole grains is really important in that diet. I just did talk about fish, but fish, especially the oily versions. Do you know what oily fish would be? Things like your salmon. Ali, sorry, were you talking there? Salmon, fresh tuna, kippers. Yeah. Do you talk about oily fish with your clients?
Yeah, that's something that we do touch on.
Okay. Yeah, so giving people sources as well, I think it's really important not to assume people will know what that is. And you get cheaper versions, the canned oily fishes like sardines and thin salmon, and are quite useful sources without being too expensive. But I think oily fish is something like Marmite. You either hate it or you love it. But it's good to try and have oily fish at least once a week in your diet, and maybe a white version of fish the other times. So really important there. The right foods we know can help combat things like fatigue. It can boost your energy levels. So without the estrogen, your bones need extra nourishment, and that needs to come from your diet. So even if you are on HRT replacements, having a good diet can still help you through this really trying time of menopause. So again, I found this calling the menopause wheel. So it just talks about hormone support, so phytoestrogens. I'll talk a bit more about that. And it kind of explains where you get it from, so kind of foods that people should include to get that phytoestrogens in their body. Bone health, of course, we talked about vitamin D. Vitamin K is really important to absorb vitamin D, so you can't do the one without the other. And calcium as well for our bones, and then some really good sources of that. Adrenal support, kind of keeping our immune system happy and healthy. So that's vitamin C, and really good sources of vitamin C is on that wheel. And then looking after our skin and hair support. So we're getting adequate, good quality protein in, vitamin E and omega-3 fatty acids, which we get in this oily fish sources, but also things like certain nuts contain that as well. So really good sources of that. So I hope that would be useful. So if you're trying to kind of think what kind of food products does people maybe need to focus a little bit more on, or to try and include in their day, so when they go shopping, that those things are on the shopping list, and that they have some really healthy recipes and interesting recipes on how to include those foods in their diet. So I hope that's useful. I think that's a nice, quite good summary of the things that we would want people to eat during the menopause. So other approaches might be a low carb approach, or thinking about glycemic index. So can I just check in, is this something that you would do? Would you talk about carb intake?
Yeah, we do, and we cover glycemic index as well.
Okay, that's fantastic. Have you kind of steered people to perhaps having a lower carbohydrate intake?
We kind of look more at the portion sizes, and again link it in with the amount that's recommended in the Eat Well guide.
Eat Well guide. So if you're working with people with type 2 diabetes or polycystic ovarian syndrome, would you try and cut down a little bit on that portions, or is that not something you typically do? Is it just kind of sticking to the Eat Well guidelines?
We'd kind of recommend portion wise probably the same, but we recommend then more kind of looking at the types of carbohydrates, so the ones which are lower on the glycemic index, and probably opting for a little bit more vegetables as well.
Yeah, okay, so this isn't something new to you. There is a approach in weight management for people who's menopausal, of trying to keep to a lower carbohydrate intake. So typically I would recommend perhaps saying to women to have maybe one carb-free meal a day would be beneficial already. So for instance, not having like porridge in the morning, maybe swapping that to an omelette, for instance, or having a salad without any bread, or potatoes or pasta in for lunchtime, and leaving a carb out at one of the meals, and then the other meal sticking to the Eat Well guide regarding portions. So that could be quite useful, especially you saw earlier on that insulin resistance is one of the things that can happen with people during the menopause. So if you have insulin resistance, your body's just struggling to manage your insulin levels, and therefore your glucose levels in your blood. So if we going for a lower carb approach, you get sort of double benefits there. So you're getting your body would be more likely to use fat for energy because you haven't given it that glucose from the carbs. So you're more likely to burn fat then, but also you're decreasing the calories because you're not having a carb for that meal as well. So you know, there's a macronutrient missing from that meal. So I'm not saying you can't have carbs at all. Let's just start with maybe one meal, not having a carb at one meal a day, and then the rest of the time just following the healthy eating principles and the portions, and also going for the lower GI choices of carbs just to keep that blood sugars more stable. Does that feel all right? That might be a bit of a different kind of advice, but evidence proves that this can really work, helping symptom control, but also for weight loss.
Yeah, no, that all makes perfect sense. Thank you.
Okay, I'm just noting a spelling mistake on cereal, so sorry about that. Oh my word, no matter how many times you read things through, you get the odd spelling mistake. Another approach to weight management is something called intermittent fasting. Can I just check in? Is that something that you guys do?
No, it's not. It's something that some clients have asked about and that they've perhaps tried in the past, but it's not something that's included in the program that we currently deliver.
How as healthcare professionals, what's your opinion of things like intermittent fasting, if I can ask?
I mean, my background knowledge is very kind of limited on this. I'm not sure. I know Elliot's had some issues. He's been kicked out, so I've just tried to get him back into this. So he might have a bit more kind of to say about that. I'm not sure if he's. Oh, yeah, he's just logging on. I've read that it can be very good at kind of helping to manage weight, but with the kind of like some of the clients that we have and things like, particularly we have quite a lot of shift workers and things like that, it can get really difficult to kind of, you know, advise them to do intermittent fasting, particularly the kind of 16-8 method.
Yeah, I've put that on here because there is evidence that it can really help perimenopausal women. I think it needs to be addressed from a safety point of view. So people with, for instance, type 2 diabetes, who's on certain medication, really should be assessed properly before you kind of go out and advise these things. The 16-8 method is relatively safe. It's not, we're not going to, you know, put people in an unsafe position if they do that. It basically just means, you know, you stop eating you know, after your tea perhaps at night, so stop eating kind of 7, 8 at night, and then you only have you skip your breakfast and you have lunch as normal. So the key here is not to kind of think, oh, I'm going to make up all that calories that I skipped for breakfast and I'm going to have a nice big massive lunch. The idea is that during that fasting period, because your body hasn't got glucose then to use for energy, it starts burning fat for energy, and it's also got quite a protective factor around your body, where because there's no food to digest, it's also like, it's easy to describe, it's like giving your gut a little bit of a holiday, and where it can sort of switch off for that period of time. A very well-known version of intermittent fasting is probably the 5-2 diet, which I think perhaps you'd feel much more comfortable in talking to people about. There's loads of things on 5-2 diets in, you know, this you know, the Mosley books for people. So that's basically 2 days of the week where you eat around 500 calories in that day, and the rest of the time you just follow the Eat Well Play guidance for healthy eating. So that could also be something that you might suggest to women if they want to try it.
So that's something that within the course that we within the program that we currently deliver, there is a bit of information that recommends that people don't go under 1,200 calories a day because of like basal metabolic rate, that's kind of the minimum amount of calories that somebody should be having. So would you say that even for menopausal women, it would still be advised to opt for potentially the 5-2 diet and disregard the other information?
Yeah, I guess it comes of, I don't know, do you guys just work with groups, so you don't work with individuals?
A little bit of both. It tends to
Okay.
be mainly groups, which obviously is a mixture of people and sort of ages and things. There are a couple of one-to-ones, but it tends to be very few, and it's just when they can't make groups.
Kind of special reasons.
Yeah.
I guess that makes it so much more difficult as a provider delivering a service to lots of people, where you don't want to contradict your general advice. And I completely get that. You know, we do a lot of groups in ABL Health as well, and you know, you want to stop confusion, and you know, and one breath you're saying don't go lower than this, and then the other breath you're saying I have only 500 calories per day. So I think this will be very much on an individual approach, where perhaps you work with someone on a one-to-one basis, or you perhaps work with someone who's really just not losing weight. You know, they're just not, they're making the changes, everything on paper and what they're telling you seems to be right, and following the Eat Well guide, and maybe using the healthy plate model as well. And still not losing weight. So it could be, if you've got capacity, that you could ask a person to try this, you know, and see how they get on, but giving them the resources to look at, you know, mostly books are really good. There's lots of things on the internet. So maybe decide on what kind of way you would steer them. And the 5-2 would probably be a lot easier than the 16-8 method, and a lot less resource heavy for you guys, because it's kind of driven by the women themselves. And there's lots of recipes of 500 calories per day recipes or meal plans out on the internet as well. So maybe this, if you want to kind of start using a little bit of this approach for some of your clients, is decide on what sort of website you would direct people to, so they don't just go on Google and, you know, find loads of nonsense out there. So it might just be that's the only work you need to do, is sort of saying, we recommend you look at this website. But I think it's for this period and this people that you work with, women in menopause or perimenopause, because this is sort of an evidence-based approach, it would be sort of sad to not give them that opportunity to maybe even think about that. So, but just maybe talking about that on a one-to-one with a client, or if you do follow-up calls for someone who's maybe hitting the menopause age and showing some of the signs and symptoms, and who's just really struggling to weight loss, to lose weight, is maybe offering this approach as an alternative. And making sure that they understand that this is an alternative, and they can try it, and you might try it for, let's say, 2 months, and if it's not working, then just go back to conventional methods, and kind of the advice you would give in your groups. Okay, so other nutrients just really we need to focus on for people, and you might have to kind of look at your curriculum and what you deliver to patients, and maybe we run women's only groups. I don't know if you do that. I think that's just mixed groups.
No, it's mixed groups that we run.
Yeah, so it's kind of just making sure that calcium is really stressed in some of your groups, and maybe bringing that into why, and that's for menopausal women. So losing estrogen during the menopause increases the rate of calcium loss from our bones, which really can increase the risk of menopause. And from the age of 35, we slowly lose calcium from our bones in any case. That's normal for everyone. So ensuring our diet contains enough calcium, make sure that whatever we lose, we put that back all the time. So otherwise you'll be losing calcium from your bones, which really just puts you at much greater risk. So taking HRT will help because that helps increasing that estrogen levels like you saw before, and that really protects the bone health. But there's also many nutrients that we have to include in our diet that can get some good quality calcium in our diet. So variety of food, so following that eat well plate is really important, and including things, really good sources of calcium like calcium rich foods, so milk, cheese, yogurt, milk-based custards or rice pudding. So making sure people understand the kind of the quantities of that as well. You know, you don't want a person who's struggling with their weight to start drinking pints and pints of milk thinking that's really good for the calcium intake. So stress the importance of portion control there as well. And semi-skimmed milk is absolutely fine, because it's although it's just lower in fat, the calcium levels are still very similar, even skimmed milk. So if people really want to kind of cut down on the calories from milk products, skimmed milk also has a decent amount of calcium in it. And then of course you can take a calcium tablet as well, which is a really easy way to make sure you're looking after your bone health. The other vitamin is vitamin D. So we already said that vitamin D can be lost through the bones due to the lower estrogen levels, and some studies have shown that vitamin D can also help to stabilize your emotions and mood. So it is quite important vitamin, especially for people going through menopause. It's estimated that about a quarter of adults in the UK do not get enough vitamin D. Many people is at risk due to their lifestyles and their jobs, and they are maybe predominantly indoors. So I know I sit indoors doing my job all day long, so the chances of seeing the sun is when I go out for my lunch break. Older skin makes the absorption of vitamin D harder. So and of course we know that menopause happens as we get older. Also for darker skin tones like African, Caribbean or South Asian people, the vitamin D absorption through sun exposure is also not great. Some people might also, because of their culture, wear clothes that covers their skin really fully covers their skin, so they don't get that sun exposure for vitamin D levels. When vitamin D levels are very low, people would feel extremely tired, kind of feel weak, so muscle weakness and just kind of feeling malaise, like, you know, like it's too much trouble to do anything. And back and bone pain, sort of joint pain, is quite common. You may be more prone to things like infection, and your skin health might be compromised. So if you sort of cut yourself, it might take a long time to heal up. It also affects your mood. So your mood might be very low. You could be at risk then, just because of a lack of vitamin D, to become depressed. If low vitamin D levels remains for years and even decades, you could be at much greater risk of getting long-term conditions like type 2 diabetes, heart disease, further weight gain because of this feelings of tiredness and low mood and lack of motivation, and also can lead to cancer. So vitamin D is a really important vitamin. So let's look a little bit more about that. It is fat-soluble vitamin, so it forms part of the 4 fat-soluble vitamins, which is vitamin A, D, E, and K. But it works slightly different from other vitamins. It's more similar to a hormone. It's naturally produced in the body from cholesterol, which is a fat. And when your skin is exposed to sun, and sometimes called the sunshine vitamin. So vitamin D plays a very important role in our bone health, but also in all aspects of our body, really. It promotes the absorption of calcium and phosphorus from your gut, and these nutrients help to keep our muscles, teeth, and bones strong and healthy. Estrogen is a key hormone for protecting and maintaining the bone density. Therefore, during menopause, bone strength is lost because of that lack of estrogen. So vitamin D is really important there to minimize the loss of that bone density and help bones to absorb that calcium and to grow new bone tissue as we get older. So how to get enough vitamin D? There's three ways: our diet, the sun, and supplements. So let's look at the diet. So really good sources of vitamin D is oily fish, which I've already said, really recommended for at least once a week to have a source of oily fish. Red meat, liver, egg, and fortified food cereals. For people who's vegan or vegetarian, options include soy, almond milk, yogurt, and vitamin D enriched products. And raw chanterelle mushrooms are a good source. So I've put a picture of chanterelle mushrooms just to kind of show you how it looks, just to remind you. You do get it freely in the supermarkets. They're quite a bit more expensive than normal mushrooms, and it has to be eaten raw, which I can honestly say I've never tasted it, but I guess that tastes very similar to a mushroom, so it might be used in a salad for people. So just an option. Sun exposure. So just kind of the facts, you need about 10 to 30 minutes a day of sun exposure on your skin without any sun cream. So if that's going to be on the hottest part of the day, which normally in the UK is anything from 1 to 3 o'clock in the afternoon, then you might burn. So please just talk about sun exposure and burning as well. The right amount of time is anything between 10 and 4, especially in the winter time. And they recommend at least twice a week to have that 10 to 30 minutes of sun exposure on your skin. So people who wear like clothes for cultural reasons, is that possible for them to sit out in the back garden and expose their skin to the sun at that times would be important. Also, kind of the importance, if you're working in an office the whole day, can I go out and even maybe have my lunch in the sun, or go for a walk in the sun in my break time or lunchtime? And then of course supplements. So the NHS would recommend 10 micrograms, which is actually really a small dose of vitamin D. It's quite hard to overdose on vitamin D. You have to take quite a lot of it. So but if we go on national guidelines, it's 10 micrograms, or sometimes it's called 400 international units. So depending on where you buy it. So it could be quite confusing. So 10 micrograms is equal to 400 international unit. And we would recommend people, especially people who are struggling with their weight, to take vitamin D every single day throughout the year. Some people only take vitamin D in the winter times because we know we don't get enough sun, but people who is struggling with their weight has a much higher risk of having a vitamin D deficiency. And therefore, if you're older, you're overweight, and you're starting on the menopause, you have got 3 very good high risks of having a vitamin D deficiency, which will affect you in all sorts of ways. So I would definitely encourage people maybe to go and have a vitamin D profile done at the GPs, especially if you're picking up that they're feeling very tired and the muscle aches and joint aches and low mood. So it could be that they need to have a vitamin D top up before they start on their own supplements that they can buy over the counter. So it could be something that people might ask the GP to do, is look at their vitamin D levels. Another thing is thinking about gut-friendly foods. So again, that's sometimes something we don't talk about enough. So bloating and cramps and kind of irritable bowel-like symptoms can happen during the perimenopause and menopause. So looking after your gut health is quite important, because a healthy gut can have an influence on your hormone and your emotional well-being as well. So eating a diet rich in fiber encourages the growth of friendly bacteria, which will aid energy levels, immunity, and weight maintenance. So having that friendly bacteria in our gut can be playing a really important role in helping people to lose weight. Healthy bacteria also improve the production of serotonin, that feel-good hormone. So if we have a lack of healthy gut bacteria, we can sort of have a decrease of serotonin as well. So I've just put there the gut-friendly foods, the prebiotics and probiotics. So prebiotics stimulates the growth of the good bacteria. So that examples of that is good old things that we would have in our everyday life, garlic and onions. I don't think I ever cook a meal without garlic and onions, but also things like asparagus, chicory, ginger, cabbage, beetroot, bananas, blueberries, and apples. So asking people to really make sure that they include some of these foods as often as possible in their diet. Probiotic foods is the foods that contain the live bacteria and yeasts, which are believed to restore help to restore the natural balance of the bacteria in the gut. So some of those are kefir, which is kind of a fermented dairy drink. You can buy probiotic drinks as well. It's normally in the yogurt section, so yogurt is also a really good example. So there's kind of fermented teas and fermented cabbage, so fermented foods. If anyone of you read a lot about diets, fermented foods is really making a comeback now. So fermented cabbage, for instance, it could be really good to have increase your probiotic. And then apple cider vinegar is known to be good as well. So it's just having a small amount of that in a day. But often myth that it helps with weight loss. It's really got to do with the probiotics. And you can, of course, buy a probiotic supplement over the counter. So, and you're looking for something like lactobacillus acidophilus as that. So you can buy that at all sort of Holland and Barrett and those kind of shop do sell them. And they vary from price, anything from £5 to like 30 quid. So it depends on how strong it is and how much live bacteria it's got in that. But if a person is maybe struggling to increase or have some of this food, prebiotics and probiotics, especially if you maybe are allergic to dairy products or you don't like yogurt, then it could be an idea to have a probiotic drink, especially if you're struggling with the bloatedness and the cramps, but you've not been diagnosed with irritable bowel syndrome. So, because that could just be the menopause causing that. A little bit on plant estrogens. So they're also called phytoestrogens. So they're very similar to the human estrogen that your body makes. And if eaten regularly and in sufficient quantities, they can start to have a mild estrogen-like effect. So it doesn't replace your estrogen that you're losing, but it can have that same effect. This can be useful then if estrogen levels decline. So for some women, these effects could be sufficient to help relieve the menopausal symptoms. So if you're having plant estrogens, it can help, but it's worth knowing that you have to take it for 2 to 3 months to see the benefits. And if you don't see the benefits, then you might need HRT. They work better for some women than others, and it might also be because of some women having sort of more foods that encourages good gut bacteria, which I've just spoken about. And consuming plant estrogens several times a day appears to be more effective compared to a large doses. So you have to have it like all the time, not just once in a week or once in a meal. So these kind of foods are soya and linseed are quite high. They also seem to be quite heart friendly as well. So other products include milk, yogurts, soya, linseed, edamame beans are quite good as plant estrogens. So alcohol and caffeine, of course, we need to talk about that. Sorry, I've got more than that. We talk about exercise. I'm sure you guys talk about exercise in your groups. So really prioritizing that, stressing the importance of exercise and what's the benefits of exercise for people as well, how regularly they need to do it. So again, your 150 minutes, at least 5 times a week or 75 minutes per week of vigorous kind of exercise, building strength and muscles is important. Leisure time, also that downtime, really looking after yourself and giving yourself that downtime as well is important for people during the menopausal phase. It's really good for mental health as well. Managing the low mood swings and lack of motivation. So that's all the things we said: sleeping well, eating right, watching behaviors like smoking and drinking, a lot of exercise, getting out, making time for exercise, checking in. Do you need kind of to replace, being on antidepressants, for instance, if you're doing everything, you're on HRT, but this just kind of things that's not working for you. Practicing mindfulness, checking in with yourself, making sure you're going out, meeting friends and having some joy as well, and get support if you need it. Don't just think I'm on HRT, I should feel better. If you don't feel better, you might need additional support. Managing worries and stress, again, maybe challenging your thoughts, practicing deep breathing. Keep a note, write a diary to see, is this linked in with some things, or how can you relieve that? And giving yourself a break, take a break, step away from the situation and clear your mind. Some things like cognitive behavioral therapy could be quite useful. And it can help people to change the way they think and behave if they've been thinking and behaving in a certain way for a long time. I've just got a bit about herbal medicine, so just worth mentioning that herbal medicines isn't always the best choice. I would definitely encourage you to ask your clients to speak to a chemist or their doctors before they're considering it. Some people take St. John's wort, red clover or black cohosh to relieve symptoms of menopause, and these are widely sold on social media. They're not always marked as healthy, so we need to have a certification mark. So MHRA look after what is in that product, so making sure that people don't just buy things that's not real on the internet, and that could make them poorly. And these are the resources that I found. So the Balance app, it's completely free for women. You can download it, and it's got a wealth of information on there. It's also got like a questionnaire to check in to see if you might be menopausal. So it might be worth asking people to go on that app if they're feeling that they might be menopausal, because it can give them sort of an indication of when to speak to the GP. There's also websites called Meno Health. The NHS has got quite a lot of information, and then of course there's nice guidance on menopause and the management of menopause as well.